Good afternoon, everyone. We are the Group 5, and the assigned topic to us is about vasodilators. To begin with, here is my group mates. First, Miss Casilia Christine, Miss Estabilio Marie Grace, Miss Marquez Alicia Cyril, and yours truly. Next, Miss Erica Angel. Next, Radao Stephanie, Valdriz Zoila, and lastly, Yaneza Julie Marie.
Vasodilators are a class of medications or agents that work by relaxing the smooth muscle in the walls of blood vessels, particularly the arteries and the veins. This relaxation causes the blood vessels to widen or dilate, allowing blood to flow more freely. By reducing the resistance in the blood vessels, vasodilators help lower blood pressure and decrease the workload on the heart. They are commonly used in the treatment of cardiovascular conditions such as hypertension, heart failure, and angina, as well as in managing certain congenital heart defects.
Here are the main types of vasodilators. First, direct-acting vasodilators. These act directly on blood vessels to include relaxation. Example includes nitrates. These drugs like nitroglycerin release nitric oxide which causes vasodilation. They are primarily used for angina. Second, hydrolysine for serve hypertension. Next, minoxidil for resistant serve hypertension. Lastly, sodium nitroprusside for hypertensive emergencies requiring careful monitoring due to cyanide toxicity. Second, indirect acting vasodilators. These work through different mechanisms. Example includes calcium channel blockers or CCBS, which prevent calcium entry into cell promoting relaxation. Next, AC inhibitors, which reduce the formation of angiotensin II, a vasoconstrictor. Third is angiotensin II receptor blockers, ARBs, which block the effects of angiotensin II leading to vasodilation.
So let's proceed to the mechanism of action of vasodilators. It involves the relaxation of smooth muscle in blood vessel walls, leading to vasodilation or widening of blood vessels. This results in reduced vascular resistance and lower blood pressure. It relaxes vascular smooth muscles, widen or dilate blood vessels, especially arterioles or veins. Decrease peripheral resistance, lower blood pressure, and lastly, improve blood flow and reduce heart workload.
So next is the indications and uses. First is the hypertension or the high blood pressure. Vasodilators lower blood pressure by relaxing the blood vessels, decreasing vascular resistance and reducing the workload on the heart. Second is the heart failure. They reduce afterload and preload, making it easier for the heart to pump effectively and improving symptoms like fatigue and shortness of breath. Third is the angina pectoris or the chest pain. Vasodilators like nitrates dilate coronary arteries, improving oxygen delivery to the heart, muscle, and relieving chest pain. Fourth and last, pulmonary hypertension, used to dilate pulmonary arteries, reducing pulmonary artery pressure and improve breathing.
So these are the side effects of vasodilators. It includes hypotension or low blood pressure. Vasodilators lower vascular resistance, which can drop blood pressure too much, especially if the dose is too high or if the patient is sensitive. Next is edema or fluid accumulation or swelling. When blood vessels dilate, especially in the periphery, blood can pool in the extremities. The reduced venous return can signal the kidneys to retain sodium and water, leading to fluid buildup. Next is tachycardia or rapid heartbeat, a reflex response to the drop in the blood pressure. The body tries to compensate by increasing heart rate to maintain adequate perfusion. Next is bradycardia or slow heartbeat, less common but can occur with certain types of vasodilators that also affect heart conduction or in people with underlying heart conditions. Next is heart palpitations related to changes in heart rate or rhythm due to blood pressure changes or stimulation of the sympathetic nervous system. Next is nausea and vomiting caused by sudden blood pressure changes that affect blood flow to the digestive system or activate the chemoreceptor trigger zone in the brain. Next is headache and dizziness Vasodilation in the brain can lead to increased intracranial blood flow, causing headaches and dizziness, especially when standing up quickly, or also called orthostatic hypotension. Next, we have joint pain can be a non-specific inflammatory response or a result of fluid retention affecting the joints. Next is chest pain. If blood pressure drops too low or heart rate increases significantly, it can strain the heart, especially in people with coronary artery disease.
Contraindications, severe hypotension, risk of dangerously low blood pressure and poor organ perfusion, aortic stenosis, vasodilation can reduce coronary perfusion and worsen syncope and or heart failure, hypertrophic obstructive cardiomyopathy, HOCM, vasodilators decrease after load and can increase outflow tract obstruction. Right ventricular infarction, preload dependent condition, vasodilators can dangerously reduce cardiac output. Shock states, example cardiogenetic or hypovolemic shock. Vasodilators worsen hypotension and perfusion. Raised intracranial pressure for certain drugs. Some vasodilators, example nitroprusside, can increase cerebral blood flow and ICP.
Next is the nursing responsibilities for giving vasodilators. So first is we need to monitor the blood pressure of the patient. We need to closely monitor the blood pressure and adjust medication as needed to prevent hypotension. Next is assessing for side effects. So watch for signs of side effects such as headache, dizziness, or flashing. Then next is we need to evaluate the therapeutic effects. So we need to monitor for the side effects such as the improved blood flow of the patient or reduced blood pressure. Next is we need to provide patient education. So we need to educate patients on medication use, potential side effects, and importance of adherence. Lastly would be monitor for interactions. Be aware of potential interactions with other medications and report concerns to the healthcare providers.
So to conclude, vasodilators are used to relax and widen blood vessels to improve blood flow that is typically used to treat and manage hypertension, angina, and also heart failure. It has two main types that is discussed earlier, which are the direct-acting vasodilators and the indirect-acting vasodilators. Although vasodilators have side effects and contraindications, taking it regularly is crucial for effectively managing the said illnesses. We also have the nursing responsibilities that includes the monitoring of the vital signs, especially the blood pressure, and assessing for the side effects, ensuring the proper administration of the medication, and also educating the patients on lifestyle modifications to complement the treatment itself. So that is all. Thank you for listening.